This is Dr. Dean Kelaita, Calaveras County Health Officer, with a Calaveras COVID-19 update for today, May 5th, 2020. COVID-19 by the numbers. As of Monday, May 4th, California had 54,000 confirmed cases and 2,200 deaths. Calaveras County remains steady at 13 confirmed cases and no deaths. No new cases were reported in the past week. All 13 cases are classified as recovered with no COVID-19 related hospitalizations. This is important as the first step in being able to relax the current stay-at-home orders in effect, requiring coronavirus numbers be stable and disease control be achieved and maintained. The residents of Calaveras County have answered the call to stay home, and thanks to them, we're in a position to begin moving into our next stage of modifying the statewide and local stay-at-home orders. Let's discuss the status of testing, which is also critical to being able to relax the current community mitigation measures and stay-at-home directives. Two types of COVID-19 tests are now available: PCR nasal swabs, which find the presence of the virus in a person's body, and antibody tests that measure whether a person has had COVID-19 infection and may now be immune. Approximately 450 COVID-19 PCR tests have been performed on Calaveras County residents to date, with 13 positive cases. The goal for satisfactory testing capability will be the ability to test 1.5 per thousand residents of the county daily. This translates into approximately 70 individuals per day. Marchway Medical Center, Valley Springs Health Clinic system will offer testing locally for their patients meeting criteria. To assist in this testing goal, the state has set up 80 additional dedicated test sites to help rural communities meet this need. The closest state test site is in the San Joaquin County, launched Monday at the Lodi Public Library in the Bud Sullivan Community Room. This is a new site through a partnership with health services business OptumServe. Testing will be by appointment only for those persons who meet screening guidelines. The testing will be conducted from 7 a.m. to 7 p.m. Monday through Friday until further notice. Appointment requests can be made online through visiting the website lhi.care/COVID testing or by calling OptumServe at their 800 number, which we'll make available. No walk-in tests are available. Because of the high mortality rates associated with congregate living facilities, an effort is underway to test all residents and staff at Avalon Skilled Nursing Facility in San Andreas, Calaveras' only nursing home. This will identify any potentially asymptomatic residents and staff in the facility for the initiation of isolation and quarantine efforts to prevent transmission within the facility. Now I'll address the current situation regarding the stay-at-home local and state directives. Yesterday, Governor Newsom announced that beginning Friday, May 8th, 2020, the state of California will begin putting into place a process to allow for a gradual move into stage 2 of California's pandemic roadmap. This 4-phase roadmap to removing the current stay-at-home recommendations and reopening the economy begins at stage 1, the lockdown which we are now in. Moving into stage 2, low-risk retail businesses and their associated manufacturing and logistical support businesses and services. Stage 3, higher-risk type businesses such as fitness clubs, spas, nail salons, hair salons, barbershops that require much more personal contact will be able to open. Finally, stage 4, mass crowd events like conventions, concerts, sporting events. Those won't come until a later date, and it won't be soon under the state plan. Don't expect them until there's a vaccine or widespread immunity. Now, moving into stage 2 of the roadmap includes creating opportunities for lower risk sectors of society to adapt a gradual reopening through a statewide modification of the stay-at-home order. Though we don't have written details yet from the state administration, we do know preliminarily what the first steps for moving into stage 2 will entail. Low-risk businesses, such as clothing stores, florists, bookstores, sporting good retailers, etc., will be allowed to reopen for curbside pickup only. These businesses will need to operate under specific adaptations to allow for increased social distancing, safeguards for their employees, and increased sanitation. This will not include restaurants for in-establishment dining or lift the overarching requirement that all Californians must stay at home still. The governor also announced yesterday that while the state is moving into stage 2 altogether, counties can move more quickly through stage 2 if they attest that they meet the state's readiness criteria. Counties must create and submit a readiness plan which the state will make publicly available. Calaveras is well positioned to move more quickly through stage 2. The governor's executive order Monday directed the state public health officer to establish criteria to determine whether and how, in light of local conditions, local health officers such as myself may implement public health measures less restrictive than the statewide public health directives. Counties must meet criteria including demonstrating they have a low prevalence of COVID-19, that they meet testing and contact tracing criteria, that their healthcare system is prepared in case it sees a sudden rise in cases, and they have plans in place to protect vulnerable populations. The state will outline these criteria in the coming days. Therefore, counties that demonstrate the readiness will be able to have the ability to move further through stage 2 of the roadmap if their local COVID-19 data allows. This readiness will be evaluated through a county self-assessment process taking into consideration the following readiness parameters. Number 1, COVID-19 prevalence defined as 1 case per 10,000 population in the last 14 days with no deaths. 2, testing capacity, 1.5 per 1,000 residents daily testing volume. Containment capacity in terms of sufficient contact tracing capability on the part of the public health department. And number 4, hospital capability, ability of the local hospital to surge bed availability by 35% and have a detailed plan to protect the hospital workforce and patients. And finally, 5, ability to address vulnerable populations. An example is the ability to shelter 15% of the county's homeless residents. Calaveras public health staff have been evaluating and compiling local data as it relates to the governor's 6 critical indicators for reopening the economy framework over the past few weeks in preparation for the ability to potentially move gradually deeper into stage 2. We have not received the template for evaluating Calaveras County's readiness, nor the process for responding to the state. When we do receive this information, we will expeditiously begin to evaluate our local readiness parameters and continue to communicate with the public regarding which local retail businesses and supporting manufacturing entities are eligible to reopen at this time. I appreciate the work that everyone's been doing in this community to prevent the spread of COVID-19 infection. This has been a really challenging time. I think the hard work that we've been doing is paying off, and I'm looking forward to be able to release more information about how we can gradually increase the business activities that are taking place, relax the stay-at-home orders, and be able to get towards life as we know it back as soon as that's possible. Of course, all the while being guided by science and medicine along the way. As I've said, this is going to be a gradual step-by-step process, and we are seeing results of the hard work that we've been doing. So thank you for your support, and further information will be released to the public when it becomes available. Thank you.